Hi, everybody, and welcome to another segment of MedTalk by Medical Tourism. I just interviewed Dr. Marcos Azulay, who is a gynecologist and has his practice all the way in Costa Rica with over 25 years of experience. And we talk about egg and semen donations to assist fertility patients. Hi, Dr. Marcos. How are you?
Hi, nice to meet you. I'm very happy to be with you here today, and thank you for the invitation.
Thank you for joining us. Don't forget to watch the full interview in Spanish. And for you international patients, I have a couple of questions that I think that might be of some interest. Can I start the fertility treatment online, doctor, by virtual consultations?
Yes, of course. We have a program for international patients that we schedule a video conference with me. In this video conference, we speak, about all the process that maybe you done before, or what are the next steps that we are going to do together. And yes, of course, you can begin with me by the conference. Yes.
If I'm looking for an egg donor, how do you determine, or how can I determine if I could be a good recipient?
We do a general evaluation of the patient and the donor. And of course, we match the donor with the patient following our very, very hard protocols. What I mean is that we matching the donor based on the phenotype of the patient, the blood type, and in general, we need to know all the medical record that you have. We ask about very simple issues like blood sample, like sexual transmitted disease, in case that you have more than 40 years old, we ask about a mammogram and ultrasound of the breast, a pap smear. So it's a general evaluation of the patient. And we begin the matching of the donor with the patient when we have all the results of the patient and, of course, of the donor.
If I'm a candidate and I get an egg donation treatment with you guys, how long do I have to stay in Costa Rica? How long will be the process? Can I go back and forth, or how does it work?
In the moment that you are a patient of Azul Fertility, we give you a timeline. So in that way, you can know how we are going to be the process and how are the steps that we are going to follow. You don't need to be here too much time. It depends your life, your work, your family, etc. So we try to arrange all the treatments in the life of the patient. That means that if you need to come to Costa Rica just for a few days, we can do all the treatment, you in your country and me in Costa Rica. And if you can come to Costa Rica and see me, and maybe I can perform a ultrasound to check you. And if we need some tests that you didn't do it in your country, we can arrange here. You have here in the clinic a complete lab, a general lab, and everything. And it's not necessary to come to Costa Rica too much days.
There you have it. And thank you very much, doctor, for your time. Don't forget to watch the full interview in Spanish. We're going to leave some subtitles for you guys. And if you have any questions, you can contact the doctor. We're going to leave all the contact information on the video. Thank you so much for listening.